My name is Anne, and I'm one of two pelvic floor therapists here at Elite. The second OT, Jessica, is with me today and will be sharing information with you as well. We both see patients with varying pelvic floor issues, and over the years have seen how young people's lives can be greatly impacted by these issues. So today we would like to give a quick overview of what your pelvic floor is and how you can best take care of it to avoid issues down the road. This is the bony structure of the pelvis, which sits in the middle of your body. As you can see, in the smaller picture, your spine attaches to the back of your pelvis, and your large leg or femur bones, which make up your hip, attach to the sides of your pelvis. This is a picture of the muscles within and around your pelvic floor. You can imagine these muscles like a bowl that sits inside your pelvis and attaches to each side of the pelvis. Like all other muscles within your body, these muscles contract and relax to allow your hips, pelvis, and back to move. The other major role they play is holding up and supporting your bladder, rectum, in females, the uterus, and your intestines. Both of these pictures show a side view of how the pelvic floor muscles at the base of the pelvis work together to hold up and support each of those organs. You can imagine these muscles acting like a hammock or trampoline, giving the support and allowing those organs to function correctly. These pictures don't show this, but your intestines then sit on top of those organs shown. As you could tell from the previous slide, our pelvic floor muscles serve a major role in the function of each of the organs they hold up. Some things that can happen when these muscles are not strong enough are overly tight or tense muscles that are not coordinating correctly. Some things that can happen because of this are urinary or bowel incontinence or leakage, even with coughing, laughing, sneezing, jumping, running, any sport or hobby. Urinary or bowel urgency or frequency. The normal frequency to urinate during the day is every 3 to 4 hours. More often than that is not normal. What urgency means is that if you feel the first urge to urinate or to have a bowel movement and you're not able to wait, or you feel you must get to the bathroom right away. Both of these things are not normal. Pelvic pain, any pelvic pain with sitting, standing, walking, running, whether for a short or a long time, is not normal. Pelvic organ prolapse. This is when one or more than one organ, bladder, rectum, or uterus, falls or sits lower than it should and then puts pressure on the vaginal canal. Pain with intercourse is also not normal. Hernias. This occurs when someone's abdominal muscles are weak or they have poor pressure management in their abdomen, and a piece of their intestine pushes through the core muscles, causing a hernia, a lump, or bulge. Low back pain, hip pain, sacroiliac pain, jaw pain, TMJ issues, and headaches are also not normal. None of these symptoms are normal and really should not be overlooked even in your teens. You may have heard older adults talk about some of these things and brush them off because they're getting older or because they have had kids, but none of these things are normal at any stage of life. We look at the pelvic floor divided into 3 sections: range of motion, coordination, and strength. First of all, range of motion. You can think of range of motion of your pelvic floor the same as your bicep. To bend your elbow, your bicep contracts. To straighten your elbow, your bicep extends or relaxes, as you can see in the first picture below. Your pelvic floor has to do the same contract and relax sequence to function correctly. The other way you can imagine this movement or mobility is similar to the movement of a jellyfish moving up and down. Coordination. To go back to the bicep visual, when you bend and extend your elbow, it should happen in a smooth, coordinated fashion, especially if you are adding weight or resistance. Your pelvis also needs to be able to move in all planes and in a coordinated way as well. The second picture shows the planes of movement throughout the pelvis and what a neutral pelvis looks like. Strength. Your pelvic floor needs to contract and relax with enough strength in order to hold all the organs up and in where they should be. When you lift or move anything, whether it is heavy or not, those muscles need to pull up and in versus pushing down and out to brace and give your body the support it needs to complete that lift or task.
The next point we want to make is about how directly related your pelvic floor and breath are. Your diaphragm and pelvic floor are muscles. They contract and relax just as all other muscles in your body. What this diagram shows is that when you inhale, your diaphragm and pelvic floor drop down or contract. When you exhale, they both rise and back up or relax. All day long, the pelvic floor and diaphragm are contracting and relaxing as you breathe. However, if you tend to breathe shallow, through your chest or only breathe through your belly, then those muscles are not able to go through full range of motion, which can lead to some of the symptoms listed in the previous slides. On average, you take about 40,000 breaths per day. If you are in a bad breathing pattern for the majority of this, it can cause issues within the pelvic floor. We would like to go through how to improve your breathing pattern. I would like everyone to place your hands on your ribs with thumbs towards your spine and fingers pointing forward. Your hands should not be on your waist. Take a slow, deep breath in through your nose and out through your mouth. You should feel your ribs expand out to the sides, into your hands versus your ribs not moving at all or moving up towards your head. There are muscles between all of our ribs, and those ribs are made to move when we inhale. Unfortunately, our bodies are good at cheating, and some of you may have developed poor breathing patterns. However, we can train our bodies to breathe more efficiently and effectively. This video will demonstrate how the pelvic floor and diaphragm move together.
In addition to your pelvic floor muscles, our diaphragm plays a key role in coordinating with our pelvic floor muscles. The diaphragm is our primary breathing muscle. It sits above the abdomen at the base of the rib cage. It drops when we breathe in, allowing our lungs to fill with air, and rises when we breathe out, releasing the air. The diaphragm is also the main pressure regulator for the trunk, giving us a dynamic base, enabling our arms to carry objects and our legs to move us through the world.
Lateral rib expansion can improve running ability and endurance, jumping, strength training and the amount of weight you can lift, singing endurance, ability to play an instrument, mobility of your pelvic floor, therefore decreasing your chance of pelvic floor dysfunction. If someone is strength training or lifting with poor breathing pattern, they may be causing harm to their pelvic floor. As a general rule, you should be exhaling during the hard part of the exercise, whether the bicep curls, squats, lunges, or core exercises. Even with functional tasks like carrying groceries in from the car, lifting a tote to a high shelf, or moving around furniture. The proper breathing technique is to exhale during the hard part of the task. If you are holding your breath during any lift or heavy tasks, you can harm your pelvic floor muscles. Even when your heart rate is high, breathing in through your nose and out through your mouth is the ideal pattern versus in and out of your mouth only. Our goal with this presentation is to provide you with knowledge and help you understand how important it is to have awareness of your pelvic floor. Some takeaways. The habits you have now with breathing, posture, and how you use your pelvic floor can help or harm you, which can impact the rest of your life. Holding your breath versus good lateral breathing, not bearing down, maintaining good posture, and any resistive movements should occur on your exhale. Thank you very much for allowing us to educate you about your pelvic floor. For any further questions, please give Jessica or Ann a call at Elite Health and Wellness at 308-455-1500.